everyone, and you are listening to our program right here, Oman This Week, and it's all about your backbone and the health. And this is, of course, we're looking at an image of an X-ray here. Our guest is Dr. Richard Marketing. And he's a chiropractor. And could you tell us first of all, welcome to studios.
Thank you very much.
What are the common problems you've come across since you've been practicing in Oman?
We've come across quite a few different problems. I mean, most countries you're going to find your average, lower back and neck pain, and we see plenty of that here in Oman. But we get to see lots of special, unique things, more unique problems to the spine that we wouldn't see in other parts of the world as well.
What would be some of these unique problems?
We see quite a bit more something called spondylolisthesis in the country here. Mm-hmm. That's when the last bone, L5, if you want to call it L5, mm-hmm. will break and start to slide forward. Now again, that can be due to maybe the high amount of osteoporosis, lack of vitamin D in the country, so the bones are weaker. So we see quite a few of spondylolisthesis as well. We see lots of genetic variables too, and I'm not quite sure why in the country. We see quite a bit of that as well.
Vitamin D would mean we can't break down the calcium.
No, so your bones can get weak, porous. They call it osteoporosis, mm-hmm. And basically, if your body's not getting the proper nutrients to build the bone mass, then of course it's going to get weak from that point. So, vitamin D is a key component to that, mm-hmm. and we get vitamin D through sunlight exposure to our skin. And so since everybody's covered up all the time, we don't get a lot of sunlight exposure. Okay. Medically, they know this. This is why most of the patients who do come in have vitamin D test done, and when they're low, they get high doses of vitamin D from their medical doctors. Okay. But it seems to be a short-term exposure, so they'll be on it for 6 months, and then
it's gone again.
And then they get off, and then a year later they get tested and it's low again. They do the same thing versus staying on a supplemental regime of proper vitamin D if you're not going to get the sun exposure. And
that can be only done by walking regularly, especially in the mornings, I understand.
Weight-bearing exercise. Oh, you mean the sunlight
vitamin
on the skin.
D, yes.
You need, depending on there's actually a lot of factors of vitamin D, your skin color, like the darker you are, the less sunlight you absorb.
Oh, really?
Yeah, because of the melanin in your skin. So, if you're really, really white, that's why they burn easy. There's less melanin in your skin. So if you're really, really white, you need less sunlight. If you're really, really dark, you need more sunlight to get that vitamin D exposure.
That's interesting. So that's just our opening topic. And stay with us right here on 90.4 FM. We go in for a short break and be right back. Very good afternoon to you once again, and this is Oman This Week, and our guest here is Dr. Richard Marketing, and he's a chiropractor, and of course our audio engineer is Ahmed Al-Arami, and this is a very important topic we're talking about, and that's the health of the backbone.
Yes.
And we were talking about how the vitamin D is crucial for the backbone and the health. And could you tell us now, first of all, what would be the challenges in overcoming that vitamin D deficiency? And you said one of them would be supplements, mm-hmm. and then you said it was 6 months, and then you can't really tell what happens after that.
You should be getting annual, really probably 6 months blood work to check your vitamin D levels, mm-hmm. to make sure they're at optimal levels. And so optimal levels, most things in the country you'll see be between 30 to 60 nanograms per deciliter in your blood. Mm-hmm. I'm more around the lines of 40 to 60 nanograms. So you want to keep it up quite high. Vitamin D controls over 1,000 different genetic functions in your body. Mm-hmm. So it's not just a vitamin, it's actually a hormone. And it's very, very important. Okay. And so, when you're low in vitamin D deficient, you're not getting those genetic functions. Mm-hmm. And so that can also
What would be the genetic functions that are not functioning because of the lack of vitamin D?
Yeah, so not necessarily, I'm not a geneticist, so I can't tell you exactly what genes are being affected directly. What I can tell you is that in genetic therapy, there's something called epigenetics, mm-hmm. okay? Epigenetics are the way your genes, they can turn on or turn off. Mm-hmm. So you can have a predisposition mm-hmm. to a disease. And you'll hear a lot of times, my genetics make me this way, my genetics make that way. Well, your parents can have heart disease, okay? Doesn't necessarily mean that you will get heart disease.
Right.
But the gene is probably most likely turned on.
Okay.
If you can then offset it by doing the right things in your lifestyle, mm-hmm. you can turn it off via epigenetics, and then pass that down to your children as well. The gene turned off.
Okay.
So this is what we call epigenetics, and vitamin D exposure is controlling over 1,000 different genes. So I'm sure if you don't have the right amount, you're turning certain genes that you don't want on, and then can effectively pass them down to your children as well.
That is so interesting because what we probably never thought, and the best way, or maybe the only way to get vitamin D is the sunlight. And that's why we were talking about the color of the skin actually making a huge difference. And so how, if you're with darker complexion, you should be walking more.
Yeah, you should be getting more sunlight to your skin. And again, as much sun exposure on the skin as possible. And that's quite difficult for a lot of the ladies if they're not outside with anything to show their skin. Then they have a hard time getting that exposure. Even if they're just showing their arms, they're not really going to get enough sun exposure.
Arms are not enough. The face and the arms.
No, the face and the arms is probably not enough. You need more surface area to absorb more. So again, supplementation would be a huge part of that into the country here. I think absolutely to correct the problem.
Okay. So you said those were the common problems you've seen in your duration of practice in Oman. What are the structure or the posture problems that have been seen?
Well, perpetual problems throughout the whole world right now, what we call forward head syndrome, forward head carriage, anterior head translation, whatever you want to call it. But it's that, your head shooting forward off your neck. And of course that comes from constant use of computers, driving, sleeping with multiple pillows, tablets, PCs, everything in our culture is out in front of us and down. Okay, so we're flexion based, so we're constantly overworking our muscles that way. And if you're like that for many hours each day, they call it repetitive motion trauma, will end up, obviously traumatically affecting our spine and the shape of our spine.
Repetitive motion trauma.
Yep.
In case you didn't think about it, you're traumatizing your neck.
Yes, absolutely. And lower back, and depending on the
lower
posture.
back.
Yep. So again, as your head goes forward, your body has to then compensate for your head going forward. So when you stand up, your body will then lean back, and so your head will go forward, your thoracic cage will lean back, and then your pelvis will shoot forward. And so then you end up with what we call your typical posture: pelvis, thoracic, head. Okay, and then you'll hear, you go to the physical therapist, they'll say, oh, you have weak core musculature. You go to the physical personal trainers, they'll say the same thing, you got to work on your core musculature. But the reality is it's all tied together, and if you're not fixing one, chances are you're not going to correct the other.
Okay.
Forward head translation or anterior head carriage has also been linked to lower back pain itself. There was a research study, I believe it was 2013, done by a group of physiotherapists at the University of Egypt, and they were able to show that reduction of forward head translation would reduce lower back pain syndromes.
Okay, because a lot of people do complain about lower back.
Yeah, and so if you just take an X-ray of the lower back or an MRI of the lower back, you may be missing the fact that it's coming from your neck.
Right. So that could be the reason why sometimes people don't get the solution.
Exactly.
Right.
Absolutely.
Okay, that's why a lot of times, I guess, people say treat the body as a whole.
Yes, and chiropractors are holistic therapists, so we are...
How do you do? I mean, what do you do, your therapy? Explain to us.
We're a multi-disciplinary clinic, so we have osteopathy, chiropractic, and physical therapy. At the moment, we'd like to add more professions as we go. The key component of the center is a 3-part system of spinal exercises. We call them mirror image. So we opposite your posture. Okay. Mirror image adjustments. So again, we're oppositing what we see in your posture, and we're sending signals via the joints. Okay. What we call proprioception or mechanoreceptors. We're sending information into that system to the brain. Okay.
How?
Through the adjustment. So you're inside your body, you have many cells. They pick up light touch, deep touch, vibration. Okay. And so those cells are then going to send those signals up the spinal cord to the brain, but they have to go through the back part of your brain, which is called the cerebellum. And so the cerebellum controls your posture, coordinates your balance as well. So by putting your body in mirror image, oppositing it, stressing it that way, and then stimulating those joints, we're able to send signals up to your brain to reset. It's kind of like hitting the reset button on a computer.
Really?
Okay. And then, of course, that's the neurological component of it. The muscle component would be the exercise. So we need to strengthen the musculature as well, because that could be weak, asymmetry, imbalance. And then third would be what we call mirror image traction. Now, most practitioners use a form of traction that's called distraction, that they pull y-axis on the y-axis, so the long axis here, y-axis translation. And those are great for discal issues if we have a disc problem. What you're missing is what we call three-point bending traction, in which we're trying to stretch the ligaments of the spine and overcome something. It's kind of like it's called ligament hysteresis, but basically like plastic. If you pull on plastic long enough, it'll start to stretch. Okay,
Right.
but you have to pull on it hard enough and long enough to get it to start to stretch.
Okay.
But your body, your biological tissues in the inside are very similar to that. So you need to put enough force and time to create that stretch to the curve there. Okay, so we're going to use mirror image exercises, mirror image adjustments, and then mirror image traction to try to restore your spine to as near normal as possible. Not everybody can get back to normal, but we can try to get to as near normal as possible. Okay.
Interesting. And it's all by communicating to the cells.
Yep. So you're trying to communicate to the brain essentially. So it's like a weird way of doing neurology. Yes.
Yes.
Yeah.
Yes, connecting it
exactly.
with neurology eventually.
Yeah.
Interesting. We'll take yet another short break and be right back. A very good afternoon to you. You're listening to Oman This Week, and our guest here is Dr. Richard Marketing, and he's from Optimal Health Center. And we've been looking at various issues of backbone and health, bones itself. But one thing that always comes to mind, I think, is the biggest challenge for road accident victims, Doctor. So what would you say, recovery? Is it possible in your therapy, and that is chiropractic therapy?
Yep. So, when we look at motor vehicle collisions, and we don't like to call them accidents because it is a collision, it's not an accident, right? So when motor vehicle collisions occur, they're at high speeds. And so we use mechanical engineering principles to look at this. Something called snap-through buckling occurs in mechanical engineering. It's when something overcomes the material's ability to maintain itself, right? And so I always tell patients, like, if you have your car, the hood of your car is flat, and you can kick the front of your car, you can punch the front of your car, you can do lots of different things, you'll never bend that hood. But if you slam that hood into a wall at a certain speed, you'll see that hood deform. Same thing happens to your spine. You have these tissues that are holding your spine in place, okay? And we talked earlier about repetitive traumas, okay? That's one way to deform those ligaments. But another way is to overcome the amount that it can hold in one quick go. Okay, so you've heard the term whiplash, I hope most people have. Yeah, and that's very common in car accidents or motor vehicle collisions. And so...
it's especially because you're wearing the seat belts, right?
Well, effectively how whiplash works is not really so much your neck, it's actually the reaction of your body. So the car impacts you from behind, your thoracic cage gets shoved forward. At the same time, your head gets slammed backwards, and that jams the joint back here, okay? And then your thoracic cage gets rebounds backwards, and then your head rips forward at such high velocities that you can tear the little ligaments in the back there as well. So we have little tissues that hold our spine together, and those can rip. And those are usually undiagnosed problems that we see a lot of times. And then, of course, your body then whips back again. And so...
What is scary, though, Doctor? I mean, he was just explaining to me that sometimes one can have a real big problem, but go unnoticed.
Yes, absolutely.
Big injuries.
Yeah, absolutely. So, if you go to an accident site, then, when the police show up and the medics show up, a lot of times they'll say to the person, how are you feeling? The person may say, I'm fine, I have no pain.
Yes.
But they just got involved in an accident. So their adrenaline is very, very high. And so you don't feel pain when you have adrenaline.
Oh, it's the adrenaline.
Yeah, a lot of times it's the adrenaline, okay? And so they don't feel pain, or they may have ripped something the same way you can sprain a ligament or an ankle and not feel it at that time, but then the next day when you wake up, then you're sore. A couple days later, then you have the pain. And so typically, patients will then head to the medical centers. The medical doctors may, at the first time of the accident, take an x-rays. And as long as something's not broken or you don't have like pathology on an x-ray, then typically an x-ray technician will say you're fine. They're not skilled in diagnosing biomechanical problems of the spine, especially in emergency room. That's not their role. And, it's an emergency case. You have cuts, lacerations, things like that need to be worked on. Then that's their realm. So when you look at the biomechanics of the spine, you'll see on X-ray reports straightening of the neck, things like that, but they don't really deem it
That's
worthy.
why you need the motion X-ray.
Well, the motion X-ray we were talking about earlier allows us to see the small, the movements of the spine, because an X-ray is still, meaning that you're not supposed to move, right? Everybody's told to hold still, don't move. But now with new technology, we're able to use something called digital motion X-ray, in which we're able to see the spine under motion. So we're seeing the bone. And we get to see the little ligaments and what they're doing in relationship to the bone. So a lot of times people can have, in a high velocity accident, like a car accident, tearing of the upper cervical ligaments, which can go undiagnosed.
Okay.
A great story is on DMX, on Digital Motion X-Ray website, of a young lady who had a motor vehicle accident. She had gone to all the medical doctors. She's telling everything's fine, nothing's wrong with you. In fact, one of the neurosurgeons actually told her, "Why are you here? Are you here to get money? You're faking it. Please leave my office."
Okay.
And so she was seeing a chiropractor actually, and he knew something was wrong, but he didn't know what.
Yeah.
He sent it to a friend of his who does digital motion X-ray, and all the upper cervical ligaments were ripped in her neck. So every time she moved her head, the first bone on top of the second bone is supposed to stay together. Hers would just slide forward and then slide backwards. And when she opened her mouth, she would lean her head, her whole neck would slide and then slide. So she was getting debilitating headaches, vomiting, throwing up, vomiting and passing out all the time. And of course, they had to do surgery for that. They had to go and infuse those segments up top. And when they sent that CD to the neurosurgeon, okay.
Went totally missing because they didn't see.
Exactly.
Now, of course, one of the problems is recovery. Now, of course, the upper neck, like you said, we don't really get to know if there is no motion. But with chiropractic therapy, actually recover a person from a road mishap?
It depends on what the injury actually is. Chiropractic's great chiropractic and physical therapy combined are great for musculoskeletal injuries, right? So if you've injured the tissues of your body, you can do some great things to recover. But it depends on what was damaged, how it was damaged, how much was damaged, And that is a misconception. People come to the office quite a bit, and it's, misunderstanding of how much can be recovered. We get cases with 8 surgeries, 6 surgeries, and they look at you like, why am I not better after 20 sessions? And you're like, you've had 8 surgeries. How are you supposed to be better after 20 sessions of care? Frankly, those people also have to understand they'll probably never be pain-free.
Okay.
They always have some semblance of pain because their body has so much damage to it. There's lots of new technologies out there that are able to do some crazy repairs of tissues. Unfortunately, they're not in Oman at this time. So, they are parts of the other parts of the world that have them. And hopefully one day we'll have them here.
And another issue I want to ask you about is scoliosis.
Okay.
And the management. Because I was under the impression that people are born with that problem. But you're saying they're not.
Yeah, so scoliosis, there's different classifications. There's infantile, which people are typically born with. They'll have it, and the medical doctors will treat that as such. Then you have juvenile, which also, again, if the child's going to the pediatrician, should be picked up at an early age. The one that most common that most people know about is called adolescent. And you had brought up to me earlier that, I thought, what's the cause of it? You asked me. And I said, it's adolescent idiopathic scoliosis. Idiopathic means no known cause. We don't know what causes it, okay? There are some theories as to what causes it, but we actually do not know. So that's the most common. It's typically seen in young teenage girls. It can be in boys as well, though. And it's that twisting of the spine. Traditional medical intervention is between 0 to 20 degrees. They're going to watch and wait. They're going to be seeing if it gets worse.
If it is not treated effectively at the right time, it can cause even breathing problems.
Yep. So, again, this goes back to that watch and wait. So watch and wait. After that, we would brace, or they would recommend bracing medically, and then after 40 degrees, they typically will recommend scoliosis. And the reasoning behind that is what you just said. They'll say it affects the heart and the lungs. Research actually supports that it has to be typically over 60 degrees, and sometimes even more than that to actually affect the heart and the lungs. So, but most of the surgeries that are done are actually done for cosmetic reasons.
Okay.
Yeah. In our center, we're effectively trying to treat scoliosis, not to, especially the big curves, the 60s, the 50s, the 40s. You cannot fix those curves. Those curves cannot be straight ever 100%. There's deformation, changing of the actual physical bone. Okay. But our goal is to reduce the curvatures, and we can do that to an extent. Again, you're never going to make that person straight, and you're trying to improve what we call their balance, their coronal balance. So it comes back to posture. You should be your pelvis in line with the floor, center to the floor, your thoracic cage center to your pelvis, and then your head centered to your thoracic cage.
Okay.
So
basically sit straight.
Yes.
That's a doctor talking.
So if you're the middle part of your body, thorax, the thoracic cage, is shifted out to the side because of the scoliosis, you're really asymmetrical. That can create a lot of pain and creates a lot of disability, especially later in life. Like a lot of the young kids won't have pain, but when they get older, they have pain.
Especially when you're playing video games. I had to say it because it all leads. I even realized that texting, they say keep your mobile straight to your face, because when you keep looking down, it affects your upper neck, upper back and neck. Upper back,
yeah, absolutely. So they call it text neck. You'll see it all through the literature. And that's again repetitive motion trauma. So that's that whole constant leaning forward. You're pinching the front of the spine, the disc in the front, and you're pushing them towards the back. So if you constantly do that, you will end up with a disc issue. So you're seeing that in a lot of young people now.
Thank you so much for this lovely session you've given us.
No problem.
And a deep insight from our postures to car accidents to scoliosis, and of course postures. Because all of us, I think, can always do a recheck.
Yes.
On how we're going about in our daily life.
Yeah, I always recommend people getting their spine checked with an X-ray, so we can assess their spine from the side and from the front to make sure they're within normal limits. And
really?
It's just the same with your blood work. You get your blood work to check if you're normal limits. You get your teeth checked to make sure there's no cavities.
Yes, because we started off with vitamin D, and it's interesting that we all want to know our cholesterol level, our sugar. Basically diabetes or not, but tend to forget about vitamin D.
The vitamin D and the spine. Nobody knows there's actually a normal spinal model that's out there. There's a geometric model of the spine, and so to go off a little bit of a quick tangent, 42 degrees in your neck. It's a circle. Okay. That's 37 degrees from certain points on the spine, T3 to T10. It's an ellipse. Okay, it's a piece of an ellipse. The lower back, L1 to L5, a piece of an ellipse. So it looks like an egg. So circle, egg, egg. And then your pelvis should also have 40 degrees. And that's the Harrison spinal model. It's also being used in the orthopedic realm as well. So orthopedic surgeons are now using their model to match the spine too as well. There are variables to that. So just like everybody else, there are variations to this, and that's fine. We know those variables as well. But your average person, about 70% of the population, will fall within that limit.
On that note, I'd like to say thank you so much, Dr. Richard Marketing, and he's from Optimal Health Center. Thank you for being here with us and giving us an insight. And we'll all sit straight today, at least today, and then really put it in our minds together. And hope to see you soon.
Thank you very much.
Thank you.
Have a good
beautiful day.
Thank you too.